Most of us don't even know what a healthy cycle looks like, and that is literally because of the gender health gap.
A lot of the health studies out there might not be as applicable to you as you think.
We exist in a system that gaslights women.
Yeah, I'm in a lot of pain. It's excruciating.
What
I think.
period pain, do you think? Very common.
No, it's my toe.
What's happening to your body? We don't know because we never really studied the female.
Remember to eat. Remember to drink water. If you're mentally ill, fix that.
One kiss is all it takes.
Falling in love with me.
Half of the world's population are women. We account for 80% of consumer purchasing decisions in the healthcare industry, yet, remarkably, our health is still considered niche. In fact, something called the gender health gap has been keeping women on the sidelines of research and investment, and that is affecting us, everyone we care for, and the economy. I'm Anelise Borges, and today on the stream we look at what's keeping women from getting the same care as men and what that means for the world we live in. To discuss, we're joined today by Shah, a medical doctor and nutrition specialist from Scottsdale, Arizona, Kera Nyemb-Diop, a nutrition scientist who works on addressing whitewashed nutritional standards. She's joining us from New Jersey. And Sarah Honey, a hormonal health expert who focuses on female holistic healing approaches. She's joining us from Hobart, Australia. Thank you all so much for joining us here on the stream today. Before we begin this conversation, here's Nadine Nasser with more on the origins and consequences of the gender health gap.
Women live longer than men. But how much does that actually matter when they spend 25% more of their lives in poorer health conditions? For decades, male bodies were used as the default subjects for clinical case studies. And it wasn't until 1993 when women were actually required to be included in medical research. Even with all the developments happening in the medical field today, the gender health gap remains between 15 to 40% poorer health for women globally. So what exactly does this gender health gap look like? Well, studies say women are more likely to be misdiagnosed or receive late diagnosis, even up to 10 years. Not to mention that symptoms for the exact same conditions can actually show up differently in both sexes. A classic example being a heart attack. We all know the traditional symptoms of a heart attack, like arm or chest pain, but it actually turns out these may not be the symptoms women experience at all. And this overlooking of female biology in medical research has led to warning signs being continuously missed for completely preventable consequences, and for many women to continue living with undetected or under-researched illnesses and conditions, impacting their quality of life.
Amy, let me start with you. Where does this gap in medical research come from, and why have male bodies been the default in medical case studies?
Unfortunately, because of the beauty of women's hormones and pregnancy, it is also really difficult to study medications and conditions. So to make it easy, researchers just excluded women because of their cycles, because of their hormones. Even animals that were of female hormone species, they thought that it would be too complicated to study things. And so that's why it's been until 1993, basically every single medical study on every single medication and condition was done on men or male mice.
That is crazy, if you think about it, until 1993. Sarah,
yeah.
It's crazy, and it has had implications, very serious implications, on us through generations. I mean, I can think of at least 4 or 5 friends who have been either misdiagnosed or have received no treatment.
Yeah, it's incredibly disappointing. On average, it takes maybe 10 years for women who have endometriosis to reach care. And I think it's in over 700 cases they found in a Danish study. They found that women were getting care about 10 to 15 years later in some cases for 700 different disorders and different diagnoses as well. And so how we research women directly impacts how we treat women as well.
Yeah, and if we are considered to be too complicated, obviously that takes long, and we keep getting the wrong diagnosis. Kera, you've been using your PhD to prove we can and should decolonize our plates. I find that very interesting when looking for better health. How much worse are things for women of color?
Yeah, absolutely. And I want to say that we've seen some great progress when we think about medical research, but for nutrition research, we're still playing catch up. And the field tends to ignore the racial biases built into it and stick to a more colorblind approach. And that's why I, created that Decolonizing Your Plate to raise attention and show that the plate is not neutral. And I agree that it's for economic reason. It's cheaper to create a clinical trial with men because we don't have to deal with the hormone. But when we look at the roots of the science and how it's been created, the modern nutrition science, it has some pretty racist and roots. And so, all these ideas started with eugenics, where a better society was a wider society with white men, where Black, brown, and indigenous people were not supposed to have children. And that's also the reason why most of the studies are still done today on white men. I wanted to add that point in the discussion.
And a very important point we came across, a review on the gendered norms towards patients with chronic pain. It points out this idea that we are seen as too sensitive or too emotional, and as a consequence, not taken as seriously as men.
Nobody freaking believes women's pain. Doctors, regardless of their gender, tend to classify women reporting chronic pain as hysterical, whereas they classify men as stoic or brave. Like, that's literally the same diagnosis they used to give women in medieval times when the treatment was exorcism. And I guess we haven't learned anything between then and now. Adding on to that, 40% of doctors said that they believe women exaggerate their pain, even though every other clinical study says exactly the opposite. And since pain is subjective and it's up to the doctor's sole discretion to gauge how severe that pain really is, we end up seeing a lot more women being treated for mental health conditions when they report pain, instead of doctors ordering additional tests and treatments. And this leads to things like the fact that women are more likely to die from heart failure because they don't receive adequate medication or treatment when they report symptoms early on.
It is quite shocking. Amy, why do you think that in 2024 our pain is still taken less seriously than men?
I think, we have, first of all, the medical studies are done on men. Secondly, when we express pain, it may be in a different way and it may be different symptoms than what is reported in the literature. And when men or the doctor doesn't understand those symptoms, they think we're over-exaggerating it. It wasn't until very recently that they realized how much pain there is when inserting things like IUDs or doing procedures on women's cervix, because we didn't understand that there were a lot of pain receptors in that area because the research is not there. So I think it goes back to studying women and understanding that they may feel pain differently and they may present it differently to their providers.
I wonder if there's some kind of experiment. You know how when they are waxing men to show them how we feel when we are getting a wax? Anyway, Kera, do you agree? And have you been told that you're too emotional or too sensitive?
I haven't been told personally, but I work with a lot of women who share that with me, and it creates a lot of erasure and mistrust, because when our pain and our symptoms are dismissed or ignored, it can feel like we don't matter. And so these women tend to not really trust medical or nutritional advice altogether, or they're less likely to follow advice and less likely to even go to the doctor or to seek help from a professional. So I think that's one of the worst consequences. And at the end, we see inadequate care. And if we think about women's health, and maternal infant nutrition, not receiving that care is really critical.
And then, of course, there is the issue many of us are familiar with of being blindly prescribed with birth control for everything and anything. Take a listen.
One more woman tells me that their doctor told them to go on hormonal birth control to balance their hormones. I may have a little bit of a freak out. Not only does hormonal birth control not actually balance your hormones, it just floods you with synthetic ones to use as a band-aid solution and just mask symptoms, but oftentimes gives us a lot more symptoms, which is a conversation for another day. But it's not actually your hormones that need balancing, and bear with me on this one. Imbalanced hormones are not the root cause of your symptoms, but they are a symptom in and of themselves. And unfortunately, most people don't understand the way that their body communicates to them is through symptoms. This is especially prevalent for women and menstrual health issues. We're just not given the resources to understand our bodies. But when you understand how your body communicates to you, how the different systems in your body actually works, as well as what can impact them, then you're able to identify the root cause and actually address it so that you can revive your cycle and have easy, painless periods with lasting, sustainable well-being.
Sarah, you are a hormonal expert. How detrimental can this be to our health in the long run?
Hormonal birth control is a type 1 carcinogen as recognized by the World Health Organization, right? So if that doesn't say a lot about what this medication does over the long term, I don't know what does. Progestin, which is a component of hormonal birth control, is known to increase anxiety, depression, and suicide in women as well. So it impacts all elements of a woman's body, especially mineral deficiencies and bone density. It impacts her gut. There's so many ways that hormonal birth control can negatively impact a woman's life. And it's very concerning that it's just kind of sold as this cure-all. And I think the reason why it's used so much is because doctors simply don't understand the woman's body. So it is very concerning, the use of this medication en masse with women.
And you vouch for a more natural, more holistic approach. Can you tell us why and how it's better in terms of a woman getting to know her own body? And can it actually substitute a doctor?
I don't want to say we can substitute doctors. I'm not anti-doctor necessarily. I think we absolutely need them because we need them for different gynecological reasons. But I think that simply depending on hormonal birth control for any hormonal woe is definitely an issue. And at its crux, it really disconnects women from their body, right? We want to be teaching women about their body. So we want to be making sure they have body literacy and they understand all of these little hormonal cues, because what they really are little symptoms that our body is communicating with us. And if we catch all these little tiny symptoms along the way, we could kind of stop something from becoming something more insidious. So if you know how to check lumps in your breast, you could stop yourself from getting breast cancer early on. If you understand what your menstrual cycle movements are supposed to do, you'll understand what is normal and what isn't normal. So you could stop something becoming worse before it does.
And what is also crazy to think about is the fact that this health gap is not affecting us in old age. No, it's affecting us right now in our, let's say, working years when we are productive and we're contributing to society. So much so that the World Economic Forum says that fixing the health gap could boost the global economy by $1 trillion. I mean, Amy, why and what are we waiting for here?
You're speaking to the person who is a big advocate of getting more research on women, more conversations going about women. I mean, it was just recently that we found out that there is a popular medication for sleep that is 45% higher in women's bloodstreams than the same dose in men. And they just found that out. And when they found that out, they said, oh my gosh, we need to half the dose. And so these are the kind of things that we are discovering by studying women. So we should continue to do so that we can start to close the gap. But the first step, honestly, is the conversation, is asking the questions and wanting more information. I think this is the kind of conversation that we should be having more.
One thing that really is still resonating here in my head when researching for this show, we found out that erectile dysfunction, which affects 19% of men, is studied in research 5 times more often than PMS, which affects 90% of us. Kera, do you agree that research is the key here? That's the most important thing when it comes to addressing and fixing this gender health gap?
Yes, I agree. It's one piece of the problem, research, and acknowledging that these health disparities is the first step toward meaningful change, but we also collectively recognize that we need to address that at a systemic issue. I think that's the first step. Also, I think the other part is it's not only research, it's also the field in itself, recognizing that, the medical field, the scientists, medical professional, public health official, they must confront their influence. And we must also talk about how it's being promoted, not only the research, but how we talk about it in the everyday life, with our patients, with the people we help, even on social media. And we need to stop promoting a one-size-fits-all. And I feel we were discussing about that when talking about the pills being prescribed for every single issue. It's really this guideline. They overlook that we have different symptoms, we have different factors, and those conditions can affect our ability to see improvement or to digest the food, and these are very important. So I would say recognizing the problem and rejecting the one-size-fits-all approach is extremely important.
Sarah, you wanted to add something to that.
But I was just going to add on to that and say, absolutely, we need more research on women for sure. From a hormonal perspective, we do have this one size fits all. We have this thing in science that we say, we are not like humans are not little mice and women are not little men. And so we have this thing in society all the time that we can just fit women into this tiny little box that we've made out for men. And we kind of forget that we have these reproductive hormones that affect every element of our life. And I think it's just kind of ridiculous. And finally, science is coming around to that. But unfortunately, we don't have enough funding for women's research because it is a little bit more expensive. But hopefully we can see this changing a little bit sooner.
It is quite sad to keep saying that we are too complicated. And so it's hard to understand and it's more expensive to study. A new study found that patients tend to be better off when treated by female doctors. Take a look.
This is the first time I'm aware of that a study showing patients have better outcomes when cared for by female rather than male physicians has actually invoked medical gaslighting as a potential explanation for why there is that difference. This study that came out yesterday in a leading medical journal called the Annals of Internal Medicine looked at almost 800,000 patients who are on Medicare who were receiving care from 2016 to 2019. The main finding was that both male and female patients had better outcomes when cared for by a female as opposed to a male physician. The benefit was greater, however, for female patients cared for by a female physician. This was true both when they looked at how likely it was for patients to die within 1 month of their hospitalization and when they looked at how likely it was for patients to need to be readmitted to the hospital after they had been discharged. Interestingly, the female patients who had the greatest benefit from being cared for by a female physician were those who were the sickest.
Amy, how many of your colleagues in university were also women? And would you agree that more female doctors could help close the gender gap?
Yes. Luckily, the rise of women physicians and women trainees in medicine has been a trend even since I was in medical school. And I do agree that, women, we experience these things. We experience PMS. We experience, a lot of us experience pregnancy, perimenopause. And so therefore, we can relate to our patients better because there's more information coming from our own body about what's happening to a woman. So I think that makes us better advocates and helps us understand women a bit better because men may not know about these conditions because they're, like we said, not studied, not talked about, and sometimes even ignored.
Kera, do you agree?
Absolutely. And I really think that when you bridge our scientific training, our academic training with our lived experience, there is a magic happening. We're not only able to relate to what our clients or patients are telling us, we're able to think about it a little bit more deeply, and provide solutions that are connecting with the people we try to help. So I really think that lack of diversity is also an issue to tackle very seriously, because we need to include diverse experiences to make our research and our solution more comprehensive.
You all are online. You're very active on social media. You have created a very welcoming space for these discussions to take place on your channels. Sarah, would you say that the online world has become an important place for women to discuss these issues and look for information as well? But it's also quite dangerous because there's so much misinformation there.
Yeah, unfortunately, there are a lot of quacks out there who are positioning themselves as experts in things when they have little to no knowledge on the female body. We have a lot of people who have done a weekend course in nutrition who are doling out hormonal health advice to people. There's even published novels and books on how women should fast that have little to no research backing their claims. It's very, very concerning, especially for us three sitting here who have educated ourselves on there. We probably see lots of misinformation every single day and just kind of have to turn our phone off and ignore it. But unfortunately, lots of women are being exposed to this information every single day. And so part of what I do is try and counteract that and put out all of the factual information to make sure that women have at least a couple of avenues to go to make sure that they know that they can get scientifically accurate and applicable information.
Amy, do you agree? And what kind of steps should women take when going online looking for information?
Absolutely agree. There is such a gap. And in the gap, there are people who are taking advantage of it in a negative way. Whenever there's a gap, there's always an opportunity for people to spread information, but also people to spread misinformation. And so right now it's completely unregulated and we get a lot of misinformation mixed with the actual information. One of the reasons I actually came online is because as a physician, I really did see the misinformation, and I thought there was a role for me giving a background from medicine and nutrition to give my perspective on issues such as women's health, women's pain, women's hormones, women's immune system, women's gut, etc. So I think there's a role. And how do you know who's an expert and who's giving you misinformation? There are clues. Sometimes it's very difficult to tell because they seem very credible. They're wearing a suit or they're extremely well spoken. And so I think that you have to look into the credentials, you have to look into their training, and you have to really trust some of the experts once you vet them out. Get your information from these credible experts. But yes, it can be very, very difficult.
Kera, this is also part of your mission. Can you tell us a little bit about that?
Yes, I can relate to everything shared before. I think it's so important for us, people who done the academic training, to come to these spaces, because for so long, it's also talk about the elitism of our training. We tend to stay within our spheres, and it's important for us to actually go into social media and share, because people are listening and are looking for this information. And that's one of the reasons I decided to created a space so that people who look like me and are looking for this type of information could find it in a different way. And then up to them to trust us, and up to us to show them that we can be trusted. And this is the world we live in. Social media is how people get their information, their nutrition health information. And we need to be more present in these spaces so that we can counteract all the misinformations.
Sarah, one final word from you. What is your message to women today who may be watching us and are wondering just what to do and how to put pressure on government authorities, but also their own doctors in terms of getting the right diagnosis and being and feeling heard?
I think the first step really is getting educated yourself. Body literacy for women themselves. You know, very often women don't know how to label a vulva. So if you go into your doctor's office and you already know more about your own body and how you can function, how you can understand your own body, and you're going in there and creating a little bit of distance between what your doctor knows and what you know, that's going to give them a bit of an impetus to go, hang on a second, how does this chick know more than me? And I think that's really the push. I think it really starts with women. We need to educate ourselves. We need to educate each other. Really, all of the grassroots movements always start with education and with communication and talking to each other and sharing information. So really, that's what the most passionate thing I am about, is about educating and giving women resources. So go out and find credible people who can educate you and share it far and wide with as many women as you can.
Sarah, Kera, and Amy, thank you all so much for joining us here on the stream today for this very important conversation. It's been great having you. And thank you for tuning in. Don't forget to stay in touch with us online. You can send us your comments and observations, questions, and ideas via the hashtag or the handle AJStream. Take care, and I'll see you soon.